If your doctor just told you your blood pressure is finally perfect, 120/80, and you are over 75 years old, you need to hear what I'm about to say. Because that ideal number could be killing you. Not high blood pressure, low blood pressure. A study published in JAMA Internal Medicine, one of the most respected medical journals in the world, tracked 15,342 adults over the age of 75 for 5 years, real patients. People with diabetes, people who had already had strokes, people with heart failure, not cherry-picked textbook cases. And here is what they found. Elderly patients with so-called perfect blood pressure, below 120, had 28% more serious falls requiring hospitalization and 14% higher overall mortality compared to patients whose pressure ran between 130 and 140. Read that again. The healthiest blood pressure, the one your doctor is chasing, was associated with more death. That is not a typo. That is the reality most people are never told. Let me explain exactly why this happens. For decades, medicine operated on one core principle. Lower blood pressure is always better. And for people in their 40s and 50s, that is genuinely true. But after age 75, something fundamentally changes in the body. The same numbers mean something completely different. There are 3 key biological shifts that happen with aging, and together, they explain why older adults need higher blood pressure targets, not lower ones. The first is arterial stiffness. Your arteries are supposed to be flexible. They expand when blood rushes in and spring back to maintain steady flow. With age, arterial walls stiffen and harden. Think of it like an old garden hose dried and cracked in the sun. When your heart pushes blood into rigid arteries, your body needs a higher baseline pressure just to deliver adequate blood flow to the brain and kidneys, especially when you are standing upright and blood has to travel against gravity. The second shift is declining baroreceptor sensitivity. Baroreceptors are tiny pressure sensors in your blood vessel walls. Their job is to detect sudden changes in blood pressure and instantly signal the brain to compensate. In a young person, this happens within milliseconds. With age, these sensors slow down. The compensatory response becomes sluggish. If baseline pressure is already being pushed low by medication, any sudden movement can trigger a dangerous pressure crash called orthostatic hypotension, dizziness, falls, and it is far more common than most people realize. The third shift is changes in drug metabolism. Your kidneys and liver at age 75 do not process medications the same way they did at 45. The same dose that worked perfectly in a middle-aged patient lingers longer in an older body, acts more powerfully than intended, and can drive blood pressure dangerously low, even if the number on the cuff still looks fine when you are sitting still. Now, back to that study. 15,342 people over age 75. Researchers divided them into groups based on the top blood pressure number, the systolic. Below 120, 120 to 130, 130 to 140, 140 to 150, and above 150. The results were striking. The lowest mortality was found in the group with blood pressure between 130 and 140, not the textbook perfect group below 120. Patients below 120 had 28% more serious falls, higher rates of acute kidney injury, and 14% higher overall mortality. The group above 150 did have more strokes, so very high pressure is still a problem. But being too low was just as dangerous as being too high. The optimal zone sits higher than current standard guidelines recommend. Here is the actual number breakdown based on current evidence. For adults between 65 and 74 who are reasonably healthy, the optimal systolic target is 130 to 140. For adults between 75 and 84 in relatively good health, the optimal range shifts upward to 135 to 145, higher than the younger group. This accounts for arterial stiffness and slower baroreceptor response. For adults over 85, or anyone who is physically frail regardless of age, a systolic blood pressure of 140 to 150 may be the most appropriate target. At this stage of life, preventing falls and preserving quality of life frequently matters more than driving numbers down aggressively. As for diastolic pressure, the bottom number, in older adults it should not fall below 65. The optimal range is 70 to 85. Very low diastolic pressure reduces blood flow to the heart muscle itself. If your diastolic is consistently sitting below 65, bring that up with your doctor, even if the top number looks fine. Now here is a simple 3-minute test you can do at home tonight with a blood pressure monitor, available at any pharmacy for around $30, that can prevent a catastrophic fall before it ever happens. The test is called orthostatic blood pressure measurement. Step 1. Lie down on your bed or couch and rest quietly for 5 full minutes. Step 2. While still lying flat, take your blood pressure and write down both numbers. Step 3. Stand up immediately and take a second reading right away while standing. Write those numbers down too. Now compare. If the top number drops by more than 20 points, or the bottom number drops by more than 10 points, that is orthostatic hypotension. That is a red flag. It means your medications may be too strong, or your blood pressure target is set too low for your individual physiology. Here is what a dangerous result looks like. Lying down, 125 over 78, looks completely normal. Standing, 98 over 64. That is a 27-point drop. Your brain is receiving insufficient blood flow for the entire duration that you are on your feet, which is most of your waking hours. If you are over 70 and taking blood pressure medication, this test belongs in every doctor's visit. If your doctor is not doing it, do it yourself and bring the written results to your next appointment. Here is exactly what you should do after watching this. Step 1. If you are over 70 and taking blood pressure medication, get a home blood pressure monitor. Measure every morning and every evening at the same time for 2 weeks. Keep a written log. This gives you an accurate picture of your true average, not one random clinic reading. Step 2. Do the orthostatic test. Lie flat for 5 minutes, measure, stand up, measure immediately again. If systolic drops more than 20 points or diastolic drops more than 10, write it down and bring it to your doctor. Step 3. Honestly evaluate your symptoms. Do you feel dizzy when you stand? Unexplained fatigue? Brain fog? These can all be signs that your blood pressure is running too low, even when the cuff reading looks normal. Step 4. Make a specific appointment to discuss your blood pressure targets, not just your readings. Ask your doctor directly. Given my age, my specific health conditions, and my physical status, what is the right target range for me as an individual? Bring your 2-week log. Bring your orthostatic test result. Show up as an informed participant in your own care. Step 5. If you are experiencing dizziness, weakness, or mental fog from blood pressure medications, say so explicitly. Do not dismiss these as just getting old. Doses can be adjusted. Medications can be changed. Treatment targets can be revised in a way that still protects your heart and vessels, but eliminates the dangerous side effects. The evidence is clear. Standard blood pressure targets of 120 over 80 are not appropriate for adults over 75. A large, rigorous study of 15,342 real-world patients demonstrates that pressure below 120 in this age group increases the risk of serious falls, acute kidney injury, and death. The optimal systolic range for most people over 75 is 130 to 145. The older and more physically vulnerable the patient, the higher the acceptable upper boundary. Diastolic pressure should not fall below 65. Do the orthostatic test tonight, start your measurement log, and have a direct, specific conversation with your doctor about your individual target, not a population average. Your blood pressure, your age, and your medical history are yours. They require a response tailored to you. If this video helped you, please share it with someone over 70 in your life. It could genuinely make a difference. And subscribe for more honest, evidence-based health information every week.